So, you've noticed a vaginal lump and you're not sure what the cause is. Well, I know it can be embarrassing or worrying to have a lump in your vagina. Having lumps and bumps around the vagina is common. A lot of women have them at some point in their life. However, when my patients come to see me and they use the words vagina, I have to check with what exactly they're referring to. So in this video, I'm going to go through the top 5 causes of vaginal lumps and the urgent signs you need to watch out for. Vaginal cysts. Vaginal cysts are closed pockets of air, pus or fluid under the vaginal lining. These can be caused by injuries like during childbirth, a blocked duct causing fluid to build up underneath the skin, or a non-cancerous tumour. So there's several different types of vaginal cysts, and if they're small and painless, you don't always need to have it treated. One of the most common causes includes the Bartholin cysts. I recently had a young girl called Sally, who was 25, who came to see me. She'd noticed a lump down in her vagina. She noticed that it's hard for her to sit, it was hard for her to walk, and she looked it up online and she thought it was a Bartholin cyst. I explained to Sally that she was right, and this was caused by a blockage near one of the channels or the ducts near her vagina. The Bartholin's gland is located near the opening of the vagina on the vaginal lips, called the labia. If this gland gets blocked, then skin can grow over this gland and fluid can back up into the gland and form a cyst. The cyst can be painless. In Sally's case, it was very painful, red and inflamed, and I needed to give her a course of antibiotics to help her with her symptoms. In some cases, you might need other forms of management, like surgery where they can drain the cysts if needed. Skin tags are another common cause of lumps down there in your genital region. Skin tags are small, protruding flaps of extra skin down below. In some cases, they can be caused by friction and by skin rubbing together. I recently saw a young girl called Alice who was a keen cyclist and had been cycling already for more than 10 years. She was always doing long bike rides with her friends and competing professionally. This meant that she would spend long periods on her bike and there'd be a lot of friction in her genital region. I reassured Alice that this small lump she had was a skin tag. I told Alice that skin tags are very common and she needs to come back to see me if it becomes painful, bleeding, growing, or she's got other symptoms that she's worried about. In that case, we can refer her onwards to my colleagues to have it surgically removed if needed. Sexually transmitted infections are another cause of getting lumps in your genital region. Where you get the lump will often depend on the type of infection that you have. The most common cause is genital warts, which is caused by the human papilloma virus. Genital warts are transmitted from sexual contact. Genital warts look like small skin-colored bumps, and they're normally rough in texture. They can in some cases cause itching and burning symptoms. I had a patient called Ben who noticed a small lump around his genital region. This lump was a little bit rough and was skin-colored. I examined Ben and told him that this was likely to be a genital wart. He asked me where did the genital wart come from. I explained that at some point he would have been exposed to the HPV virus, and there's hundreds of strains of this virus. Some strains of this virus are associated with genital warts. He told me he'd had 3 sexual partners and he wanted to know which partner had given him genital warts. Well, with HPV, you could have had it for a long time before you had symptoms. So I explained to Ben that it's impossible to know which partner he would have got it from, because it could have been a long time after he was exposed to the HPV virus before he developed genital warts. In Ben's case, I referred him onwards for more management because he wanted the warts removed. There's different methods that we can use to remove genital warts. Watch my other video here. Vaginal cancer. Cancers of the vulva and the vagina are very rare, so if you do have a lump down below, it's very unlikely to be vulval cancer or vaginal cancer. Symptoms that you may experience with vulval or vaginal cancers can be abnormal bleeding, abnormal discharge, noticeable lumps down below, painful sex. If you do notice that you have a lump down below and you're worried it might be cancer, it's always best to see a doctor as soon as possible so we can do the necessary investigations. Ingrown hairs. If you're watching this video and if you've ever shaved, at some point or another you've probably had an ingrown hair. Shaving, waxing or plucking pubic hair all increases your chances of having an ingrown hair. Ingrown hairs can cause a small round bump which can be itchy or painful sometimes. The bump may sometimes get full of pus, or the skin around it may also become darker. When to see a doctor? It's always best to see a doctor like me if you've got a lump down below and you're not sure what's going on. We're happy to reassure you and check you over and do any necessary investigations. And we also understand that this can be an embarrassing topic. So if you notice a lump down below or new symptoms, it's been a few weeks, you're not sure what's going on, always book an appointment. The bottom line of this video is to say that there's many different causes of vaginal or vulval lumps. Most of them are not serious, but we need to give you the right treatment. Thank you for watching The Travelling Doc, and if you can click the word subscribe, it really helps my channel to keep on growing. Bye bye.